Right, so let's go ahead and get started. Good afternoon and welcome everyone. Thank you for attending this exciting HAP webinar. My name is David Rissam. I've probably talked to you before or met you in person. I'm a sales brokerage advisor here at Insurance Advisors Direct. IAD, if you don't know already, IAD is a full service FMO, and our commitment is to make agents successful in the field of insurance and Medicare and other products as well. We provide our agents lots of services ranging from education, marketing materials, sales tools, and more. Today, I would like to welcome Kyle. Kyle is from Kyle Ingraham from HAP, Health Alliance Plan, to educate us more about how you and your client can navigate HAP. If you have any question at any time during this webinar, I have both the chat box and the Q&A box as well. It is open to everyone, so go ahead and type your question or type your comment and we'll get to it for you. We'll answer all the questions that you have. Kyle, I'm going to hand this to you, and thank you.
Yeah, sounds great. Thank you very much, David, and thanks for the team over at IAD for putting this together. Good afternoon, everyone. And as David had mentioned, my name is Kyle Ingraham. I'm the lead Medicare consultant here at HAP, working with all the agents here in the state. First of all, I always like to start these off by thanking each and every one of you for taking the time to join us today, and also for everything you do for our members. HAP is very proud to say that 85% of our business are written through independent agents like you in the state. So thank you very much for everything you do. So as David had mentioned, today is not going to be a PowerPoint presentation. What I'm actually doing is going to be a little bit more interactive. I'm going to run through a few of our systems, show you how to utilize them, where you can find different information. And then, of course, if you have any questions along the way, as David had mentioned, feel free to drop them in the chat box or the Q&A. So where we're going to get started today is on HAP.org. So HAP.org houses a few different things that you and your members are able to access. Number one, it has our agent portal in it. So that's going to give you access to our Medicare enrollment tool, our under 65 enrollment tool, as well as Calidus, which is like our commissions and book of business pages. It's also where your members can log into their account. If you have members who are able to utilize the computer and go into their accounts, they can actually sign up for health rewards through there, get some rewards for going for their preventative services, as well as change their PCP if you wanted to, and a few other self-service items. So that is good for you to know as an agent. If you do have, one of those T65s that's comfortable logging in online, they're able to do a lot of those things right there. And then it also houses our Find a Doctor tool, which is probably the one thing you're going to use the most on it. So we're going to go through a few different ways to utilize that depending on what you want to search. What we're also going to hit on today, we're going to go through our, let me just make my list so I don't miss it. We're going to go through Delta Dental's website to show you how to search for providers there as well. We're going to hit Ascend and how to utilize that, especially for looking up drug cost estimates. And then also our materials ordering site. So once we get through all those, it's going to give you a pretty comprehensive idea of all of our different sites that you'll use and how to navigate through those. So to start off, I'm going to go over here on our homepage at hap.org and click on log in. This is if I want to log in. Let me log out here. Sorry about that. All right, so when you click log in, you or a member are going to go to this page. I started off with saying the member is right here. The first time they are using this account, they're going to need to go here and register. To register, they're going to need their name as well as their member number so that they can go ahead and get registered along with some other information like setting IDs and everything else. Now, since I don't have a dummy member account, I can actually log in there and show you, but that's the main thing to know. You're going to click register, and then you're going to go through and have to provide this information here to go ahead and register everything, create your password, your challenge stuff. You can sign up for paper, email, EOBs on this page as well. And then, of course, the privacy information. So Very useful thing to have, and know that members can go in there and utilize that to get themselves taken care of. Now, I'm going to go back here because the more important one probably for you is the agent profile. So I actually do have an agent profile, though, of course, nothing is in it. So you're not going to be able to actually see reports or everything, but I can show you how to log in. So once you log in, and again, you'll have to register the first time you go on the site as well using your NPN and other information. But once you're on this, you have a few different things right at the top. So you have your Medicare enrollment tool. If you click that, that's going to take you to Ascend. HAP Connect is going to be our quoting tool for individual business, the under 65. And then the one thing you'll probably log on here the most for is Calidus Cloud, so our commission systems. So I'm going to go ahead and click right on that. And this is going to take you to the main page. Again, I don't have anything on mine, but you'll see here on the left-hand side of the search bar, you have book of business. So you are able to check book of business as a certain processing date. So if you want to go back a month before and then go back and kind of audit your book from the information, even though we do send those disenrollment emails, if you just want to do it yourself, you can do so right there. The other part is going to be commissions. So you can pull your commission statements here as well. If I was an actively writing agent, you'd see all of the statements listed here below. Also on here, if you're going through, you can pull commission summaries by member as well on the top part of this page. Now, I will tell you, I understand for some compared to other carriers, it may not be the most seamless commission portal that we have out there. I can promise you, because it's been expressed to me multiple times, we are currently working on a new one right now. It's a very big lift to do when you're launching a new portal. I believe ours is going to be accessed through a backend side of Salesforce, so it's going to be very up to date, very easy to use. But we do not have a date for that being launched. I just wanted to let you all know we are currently working. When it comes to that, though, that's pretty much the most you need to know about this portal, is just that you can get your commissions and book of business summaries. The one thing I will say, book of business will not be updated with members until commissions have been run on it. So that's one of the things that I know we're lacking on, and we are going to be working to correct that in the future. But for now, just know if you've enrolled somebody and it's been 2 weeks and you don't see them, it won't populate until we run commission on it. So I'm going to go back to HAP.org here. All right. So those are the two portals on HAP.org. That is your member enrollment portal, or your member sign-in portal, and yours as an agent. The next thing I wanted to talk about is our Find a Doctor tool. So when you click on Find a Doctor here, another screen will pop up. Just click search. All right, perfect. So when you are searching for a doctor, you're going to come down, and the one thing I would highly suggest is selecting the insurance plan you want to search. Otherwise, it's going to pull from all of our different networks, our under 65, our small group, large group, self-funded, everything like that, and Medicaid. So you really want to go down to the Medicare plans, and the vast majority of people are enrolling into the Senior Plus or the MSU Healthcare, the HMOs. You can click one or the other if you're searching for them. They are identical networks, but I'm going to hit Senior Plus for now. So then there's a few different ways you can search. One is if the person's seeing a particular doctor, you can go down here and say, there's one I looked up the other day for somebody. So William Sulaka, you can click that and then search, and it's going to show you any of the locations that we have him in network for. So you'll see we have him on a Haggerty Road location as well as a Maple Road. If they're showing up when you select the plan there, they are in network. So that is the key to know, as well as if they're showing a PCP ID, they are in network as a PCP for your member. So important to know that as well. If you do click on that provider's name, you're going to get some additional information, such as that address. Obviously, it's going to be selected to just the plan you picked, as well as some information on the background of the provider and their affiliations. So helpful little piece there. Now, if I go back and I want to do a new search, say you have a different situation this time, you are searching any provider for the member in that plan. They just say, I need a PCP within a certain distance. This is how I would do that. HMO Senior Plus, let's say Troy, Michigan, because I'm sitting in Troy right now. Search providers. So this is going to pull every provider available in that area within 10 miles. I would then come down here and click primary care physicians if they're looking for a PCP and hit apply. And that's going to filter it down to all the PCPs we have within 10 miles of Troy. So if they're just saying, hey, find me a doctor in network within a certain distance from the plan, this is a great way to do it. Allows you to search everything else right then and there. If they need to see a different type of specialist, so they say, and I'm going to do this a little bit different. Say I need to see a cardiology doctor, I don't care which one it is, just somebody that the plan takes. Again, that's going to pull up all of our cardiologists in network. You can refine that down by saying, my clicker will work. Troy, Michigan again. Click that. So as you can see, we have 94 cardiologists within 10 miles of Troy. So quite a wide network. But I purposefully did not select an insurance plan on this one because I wanted to show you, if you forget to do that, how to take a look at it. So I'm going to click on Dr. Craig here. Now, when you go in, you're going to see now a whole list of all the plans they accept. This is why I say to filter down to the plan you want, because otherwise you have to sort through all this and try to find their plans. All the Medicare plans are going to be together here. So you'll see they do accept all of our Medicare Advantage plans, but you have to sort through all that to find the plan. That's why I always say, go ahead and just put in the plan that you want to search. That way, you're checking the full network. One other thing is if you need a certain type of facility, so you can click on the right-hand side of that search tool and look at all the different facilities. The reason I show you this is the ambulatory surgical centers. I know we talk a lot about these in our product presentations, how members can get a reduced copay if they're going to one of those. So as you can see, you can now search, within a certain range. Again, I'll do Troy, Michigan. How many of those we have? So look at that. Within 10 miles, we have 25 of these ASC centers that members can go and seek services at. And again, we can narrow that down to our Medicare plans by using that toolbar on the left-hand side. And for Medicare, 23 different surgery centers within 10 miles of Troy. So as you can see, very big network for those, but that is how you can search. If they just say, hey, find me an area to get this done, you can look it up there as well. Moving along to kind of pair with that provider search tool, I wanted to go into how to find a dentist because we do utilize the Delta Dental Network. We do not have their dentist loaded into our site. That could just cause error. If they remove a dentist or one way or another and they don't update us in a timely fashion, it could cause something to not show properly, whether a doctor in network and they're not, or vice versa. So we utilize the Delta Dental website. So you go to dentalmi.com. You want to make sure you're searching the Michigan network. And once you're on that site, you're going to go over and click on Find a Dentist. Once you click there, for the Medicare Advantage networks, there's a blue box or teal box in the middle of the screen. If you're searching for our embedded line, our Buy-Up Dental's Delta 50 or Delta 70, you're going to click on the Medicare Advantage PPO and Medicare Advantage Premier search. If you're enrolling a member into that Delta 100 Buy-Up, so it's just the PPO network, you can narrow it down to just that network by clicking the Medicare Advantage PPO. So I'm going to go ahead and click on our full network one. One thing to keep in mind here, this is a little deceiving. It has this little red asterisk right next to the zip code. It actually doesn't require a zip code. It just requires a combination of a few things here. So I can actually just search Michigan. I find that to actually be better because if somebody, lives in one area, but their dentist is 20 miles away from them, you don't have to worry about that radius bar. It's going to pull all the dentists in Michigan for them. Whoops. There we go. And then you move down into the search criteria area. So you're going to search last name. Let's go. I say that because I'll pull up my dentist since I know she's in here. So Delta does have a small glitch in their website right now in terms of this box here where it says Medicare Advantage Network. If you see a comma in that box, that means the provider accepts both the Delta Premier and the Delta PPO networks. If there is no comma in that box and it's just blank, it means they're just the Premier network. It's just a glitch in their website right now when you narrow it down by anything but zip code. So we always just like to go over that. Comma in the box means Premier and PPO. If there's no comma in that box, but they do appear, they are a network, but just with the Premier. Then again, it's going to show you the locations here. So sometimes for a provider, you may see 3 or 4 locations. Just make sure you remember seeing them at one of those locations because they could have different practices they work for, different contracts. So you always want to make sure. And then if you click information there, you're going to get some additional info, where they went to college, any of that. Are they accepting patients? Everything else is rate listed there for you. So it is super easy to use that tool. Just wanted to make sure you're aware. Go to Delta Dental MI, search the Medicare Advantage networks. I know I've had some people go to other networks and they'll just go to deltadental.com and that's searching commercial networks and everything else across the country. So you really want to go to Delta Dental MI. The other thing I'm going to show you is you're going to see here out-of-state visitor travel benefit. So our HMO members can utilize an out-of-state travel benefit for dental in Florida, Texas, or Arizona. The one thing I want to let you know about that, though, is the member has to call Delta Dental to start that process if they want to use them, if they're in Florida for 6 months or something else. The reason is in Delta's system, they combine both our HMO and our HMO POS members under one category, and the HMO POS does not include that out-of-state benefit. So we want to make sure that they qualify for the benefit and they'll set them up and search a provider for them, make sure they're in network. So they can utilize it when they're out of state, traveling to one of those 3, if they're on the HMO or PPO, they can go ahead and just check this to make sure somebody's in the PPO net, or, if they're out of state, they can use this benefit. HMO, they have to call in first. All right. Next thing I'm going to hit is our Ascend. Let me actually get my Ascend actually pulled up. Actually, I'll do this the easier way. All right. So hap.isf.io/2023/agent is the login that you'll use. Everybody has this in emails from us. We send it out multiple times a year so that you have the direct Ascend enrollment link, or you can download the app as well to utilize it. But I'm going to go ahead and log in here. All right. So mine looks a little bit different from yours, just because obviously I have an admin portal and a few other things on mine that I can access. But the main thing you're going to be using this for is obviously enrollment, but don't forget you can quote drugs within this tool. So I'm going to say you put in the zip code and then just click go to plans. And then if you want to quote drugs, you can just go up to this toolbar up here where it says health profile and click on my drugs, and that's going to get you going with it. So do you want a specific pharmacy covered? Yes. Hopefully you are all taking advantage of our mail order for our 90-day mail order. Click that and just hit the search tool. You're going to want to make sure you click on the Henry Ford Medical Center, the Rochester Hills location. That is Pharmacy Advantage. And then click continue. Yes, I'm going to take prescription drugs. So let's take a look here. We got, let's say, metformin. I'm gonna take the tablet. I need one a day for 90 days. So that, oops. Every 3 months. Add to prescriptions. Then let's go with Trulicity. Add. All right, let's go. Let's say they need one of these, one package a month. So three. Prescriptions. All right, so let's just do those two. If you want a specific doctor covered, you can put that in here as well. So let's say yes. Again, we'll use that Sulaka. Just again, I looked them up just the other day. William Sulaka. Let's say the maple. Then the next one's going to ask if they receive extra help. So you can go into this, put in the member's first name, last name, date of birth, and their Medicare number, and it's going to check their status. If they do have LIS, it will apply the LIS pricing to the drug cost breakdown. So that's really nice to be able to sit down and tell an LIS member exactly what their costs are going to be. Since I don't have a specific member, I just hit continue, and you go back to this page here with all of our plans. You're going to notice there's a drugs monthly breakdown button. So you're going to go ahead and click that. And it's going to show you the cost here. So I did the 90-day mail order, and I specifically picked metformin and Trulicity because it's going to show you a couple of things. One, you're going to notice $0 copay for Trulicity and metformin in the first quarter. So that's with Trulicity being a tier 2 for us. They're actually going to save a bunch of money that first quarter by having it for $0. The next quarter, you're going to notice this says under phase here, initial and gap phase. So metformin didn't hit the coverage gap for them, but as soon as you added in Trulicity, it got them into the gap at some point. So that's $144 for a 3-month supply. Third quarter, you're fully in the coverage gap, but notice metformin, because that's tier 6, it's going to remain a $0 cost share for the member. Trulicity then does go up to its normal quarterly price while you're in the coverage gap. So that's going to be pretty consistent across all carriers, right around that $650 mark. And then same thing for fourth quarter. So on just these two drugs, they're not going to reach the coverage gap, or excuse me, the catastrophic phase. But if they did, it would show up right in here. So you're actually able to break this down for a member and let them know quarter by quarter, or if they're doing monthly, month by month, what their cost is going to be when you're going to hit the coverage gap and all of that information. The one downfall of this is you can't print it, but what you can do is copy and paste it and drop it into a Word doc and print it that way, or into an email. So I see that to be extremely helpful for agents. Now, the other thing I wanted to mention is we did the pharmacy and a provider. So it's going to show you right here at the top part that both the pharmacy and the provider are in network with that little green check mark. If they were not in network, there would be a red X there. I think they're both in network for all of our plans though. So Henry Ford Medical Center, see here, because this is an HMO, the MA only, pharmacy is not included. So you'll see that's kind of what it looks like when they're not in that little red X. So that is a great option. If you're sitting down talking to members, wanting to show them more details, you can click the view plan details. And that's going to show them a more comprehensive. You can send a quote as well. So you can put in the name and information. That's going to send a copy of this actual breakdown for them. And again, it's going to send kind of the drug costs as well that's in there. Or you would click apply now if they want to go ahead and get started. And that takes you right ahead into the application. Now, because you actually logged into this version, you will see your username up top there, and that means you're going to get credit. If you go to just what we call the direct to consumer site, so that's if you were to click in from our agent portal there to this direct enrollment tool, it's going to take you to excuse me. This site right here, which looks this actually, because I'm on this, it's not going to show. Let me just go into a different screen. Sorry, guys. Right now. Either way, when you go to our direct site there, copy paste this. It will not have you log in. I just want to show you how it does that when you go to it. There we go. So you're going to see it goes straight to this quote page, but you're not logged in. You don't have your name anywhere or any of those other options. At the end of the application, it will ask for your name and NPN as the broker. You enter it in there, and that's how you get credit for that. All right. See, I got a question in here. Is the price quoted the same even if they do not choose mail delivery? Not necessarily. So there are a few drugs, tier 1, tier 2, that you're going to get that 90-day mail order for $0 cost share. You cannot do a 90-day supply for $0 at a retail pharmacy. So you're going to want to make sure that you click the proper pharmacy and dosage amount that they're going to get, whether it's their 30-day amount or their 90-day amount, to make sure that that's going to reflect accurately in that quote. All right. So the last thing I'm going to take you to today is our materials ordering site. So that is hapagentportal.com. So once you're here, you're going to click log in. If you don't have access to this, shoot me an email after today and I will go ahead and get you a username and login. But once you log in, you're going to go to, again, we're going to look slightly different since I have a users and admin function available to me. But you're going to click Order Wizard. Then once this drop down comes up, bulk marketing collateral, and click next. And that's going to take you to our ordering page. You're going to notice at the top here, there's a couple of tabs. They haven't deleted 2022 yet. So just make sure you're on the right year. You're on 2023 to order this year's materials. And then you go ahead and go through. You have our HMO and HMO POS kit, plan summary, West Michigan plan summary, our plan specific for MSU healthcare. That's a big hit in Lansing, especially. PPO and everything else is right here. So you're going to go in and put down how many you need and then click next step. So let's just say one of these just to move us along. It's going to have you confirm your order after you look at your shopping cart, and then it's going to have you go through everything else right there. Once you hit next step, it's going to go ahead and have you confirm and place your order. Once you do that, it's going to go ahead and go out. If you click a quantity where you need, it says it needs approval and you really think you need that amount, go ahead and put it through. It will come to me to track the orders. If I think it's something wonky and it's way more than you need of something, maybe you put in 100 instead of 10 of a kit, I'll see that, reach out to you, make sure and update the quantity if you want. So with that being said, that's kind of all of our sites I can think of off the top of my head. If there's something else you want to see while we're on here, I know you can't hop in and speak, but please feel free to put it in the chat box. I'm happy to show you anything else you want to see. If not, thank you very much for joining us today. David, I kept it right about at the half an hour I promised.
Yeah.
And again, if you'd like to get together, walk through any of this in person, if you want to talk through marketing ideas or just learn more about HAP in general, feel free to reach out. I'm going to type my information in the chat box so you can all see it. Feel free to reach out to me anytime. I'm happy to help with anything, meet in person, whatever it may be.
Okay, Kylie, I do have a question actually on the Delta Dental plan. So basically you talked about the buy-ups, the 50, 70, and the 100. The 50 and 70, they can choose a doctor from the PPO and the Premier network?
Correct. So our embedded dental benefit and those first two buy-up options utilize both the Premier and PPO now. Including
the DSNP plan?
No. The DSNP is just the PPO network.
Okay, that's what I thought.
Yes. The Delta 100 for buy-ups is only the PPO network.
Okay.
Thank you for that clarification. Our DSNP and the Delta 100 are the two that are limited to just the Delta 100 or the PPO network, excuse me.
Okay. And also on the find doctor. I don't know if there is any other question coming up from anyone, but find a doctor. There is that plan that I don't remember what it's called actually, that works really well for northern Detroit, but not so for the southern south of Detroit, like Dearborn. What plan was that? As far as doctors network.
Oh, I think you're thinking about the primary choice plan. So that's
Right.
our more narrow, that does not include Henry Ford PCPs. So it's going to be the Jackson Health Network, Oakland, Southfield Physicians, and a couple others that are in the IHA.
Okay, just making sure, because I tell you what, I've heard of some agents, they think that the network is all one. For example, I had a situation when I was enrolling someone, the doctor is not in the HMO, but in the PPO. So you got to look really carefully.
Mm-hmm.
Yeah,
that's why it's very important to make sure that you're selecting the plan that you want to use, so
right.
that you're searching the proper network.
Right, because they're different networks. Yep. Looking for anybody who has any question, please go ahead and type them in the chat box. Other than that, if you have any question, you can always call me. I mean, I think I talked to most of you here in the I can see the names. But if there are no questions, then thank you, Kyle, and thanks everyone for attending this webinar. This is really valuable information, and it clarifies a lot of gray areas there. And we're going to have another webinar on May 5th at 10 a.m. That's going to be on dental. Kyle is going to be talking to us, walk us through on the dental benefits. And so I'll be emailing each one of you with my contact information. Kyle's information, he already put it in there if you want to write it down.
Looks like somebody may have a quick question, just waiting for them to type it in here.
Okay.
That is a preference for you when it comes to, the question is it best to enroll through HAP portal or through TrustyCare? That is completely up to you, whichever system you like to use. It's one isn't better than the other that I can say in terms of how it's going to work out for you. They both come to the same place and the enrollments come through. So whichever one you'd like. I just don't have access to TrustyCare to go through that, but I'm sure David would always be happy to do a walkthrough with you at another time.
That's true. Yes, if you need any help with the TrustyCare, let me know, and should be able to assist you with that. Any other questions? Any other comments? All right, going 1, 2, 3. Okay. Well, once again, thank you very much. You can call me. I'll be more than happy to assist you. My contact information is you can call me on my phone, IAD phone, 800-381-0977. I'm at extension 127, or you can email me, drassam@iadbrokerage.com. Thanks again for attending. Thank you, Kyle, again, and everyone have a great day.
So thank you, David. You have a great one.
Thank you. Appreciate it.